Hi, everyone. As you know, my name is Dr. Rashmi Shram, and I am thrilled to be here with you. The most thrilling part of today is going to be that we are going to get to talk to my good friend and colleague, Dr. Sonya Dominguez. I want to tell you a little bit about Sonya. She is actually the Associate Program Director at St. Vincent's Family Medicine Residency. She is also the president of the medical staff there. She is an incredible physician leader. She is the co-chair of the Clinician Engagement and Wellbeing Committee, and she is a professional juggler of all things mom, working mom related. And most of all, she's just an incredible human being and has led her team really through the pandemic. And I wanted to ask her a few questions about that. So welcome so much, Sonya.
Thank you. Thank you so much for having me. I'm not sure I'm an expert in that, but I can certainly share my experience, our experience, and it's really a good time to just reflect on that because we've been moving, so quickly that it's often not easy to just pause and kind of see where we've been and where we need to go.
You're right. That's such a really good point because sometimes when we're in the tornado in the middle of that, it's impossible to make any kind of reflections. And so this is a real time of gratitude. We should really be grateful for this break and sort of looking at the light at the end of this tunnel. So, with that in mind, I'd love to hear some of your experiences just, on the front lines through the pandemic and what tips and tricks you decided to use or tried and continued as you went through the pandemic to keep yourself healthy.
Sure, sure. And full disclosure, was not an ICU doctor or one of the amazing
That's a
nurses
problem.
in the ER, ICU who were really there, frontline with the intensity of this. But I do take care of patients in the hospital and I do take care of patients in the ICU. And I have had patients, unfortunately pass from COVID and interacted with families. And so certainly with that, small number compared to the day to day, has definitely left a big impression. And, I can only imagine what my colleagues that are doing this full time are going through and will be going through in the future. So I have a little bit of a different experience in that, I get to be in the inpatient setting, but also mostly outpatient. I do train young doctors. And so that is where, my experience will come from. And so yes, just in terms of, I think one of the most interesting things about this is that, we saw some of it coming, but the rate at which it happened was so quickly and so different. And, it was really hard to prepare. Here in Jacksonville, we're used to hurricanes and, you have a little bit of lead time and you have policies and protocols and you know what to expect. And this, we did not know what to expect. And so, as physicians, as scientists, so much of what we do is driven in data and, PDSA cycles. And this, this was new. This is, one of those things you hear your attendings about, like, oh, when I was a resident or when I was in training, we had polio and we didn't know, this was kind of our first, I think, real experience other than HIV, but that was very early in my training. Where people were looking to us for answers and we didn't know yet. And and we're still learning so much so quickly. So I think that was very different, especially being in a leadership position where people are all of a sudden looking to you. And I remember very distinctly my boss and his boss were away. At the time, we really had to decide what we were going to do about seeing patients. And so it's interesting. I've heard other colleagues in that situation about, how are we going to screen patients? How are we going to keep our staff safe or other patients safe? And I work in family medicine where we take care of, newborns and pregnant women and geriatric population. And so very vulnerable really on all ends of the spectrum. So kind of making an executive decision to say, you know what, we're not going to have patients come inside until we know that they're not symptomatic, and really just setting up a table outside with, questions from the CDC and thermometers and, very much of a organized chaos, I guess. But a lot of us did it the same. So we thought, well, that must be, what we do until, we were able to get that kind of information from our organization. And luckily, work in a great organization that was very organized and very forward thinking about all of this. And I know a lot of my colleagues are, were in private practice or just in different situations. So I at least had that to lean on. So that's one thing. I think the other thing is, like, there was no warning of, and I think a wake up call of like what life was like, right? What normal, what we took for granted, and like what was going to change. Like, just, I'm in my office with the door closed so I can talk to you remotely without a mask. But, now it's instinctive. As soon as I walk out that door, I'm with a mask. Like, I took for granted that I didn't have to wear a mask every day. I didn't hug my kids for 3 weeks because I didn't want to infect them. And I was the one seeing people and, stripping down in the garage and running through the house to get in the shower. I mean, I've never taken so many showers in my life, even when I was younger and played a lot of sports. But just all of those things that you had to think about, like, hey, toilet paper, right? Like, we were even just those little things. And, in the hospital or office setting, we were worried about supplies, and all the chem wipes that we used to take for granted were just everywhere. And now, you're having a hard time getting these things in. So yeah, so I'm probably rambling. I don't remember the exact part of the question, but
No, it's
just so
great.
many things.
Yeah, yeah. I think you hit the nail on the head, really, right? Like, there was real fear at the beginning. I remember that as well. I had just transitioned into telemedicine at that point, unknowingly, but my husband was still, seeing patients, and so same story, stripped down the garage, and then for me, there was kind of an unprecedented opportunity in telemedicine for those 2 months, and so I spent a lot of time, telling people that I didn't know. And so, or patients rather. So I
Right.
think that's the real kind of stunning part of some of this is, of course, we're still learning, but, back then when people were looking to you as a leader, as a physician, we were, we just had to do the best we could. And that's exactly what you did. And then just as a whole, how it sort of just gave you this pause for, gosh, I've taken so many things for granted, including hugging my kids, and I can't even do that. And so, yeah, I think those are some real challenges to overcome for sure, for sure. So what sorts of self-care practices have you put in place for yourself, and tell us about that?
Sure. I mean, I think that's a journey for all of us, especially as moms, as working moms or non-work, or moms that work in the home. We tend to, usually take care of those that need help more than anything. And usually we get kind of put on the back burner. And so, I think, there's no real perfect balance, I think, in all of that. And I think, you do what you can in the moment. But I think for a lot of us, everybody sort of runs, at a kind of steady pace, and you get things that come your way. And maybe there's like a school assignment or assembly you have to, and you kind of work that in. And I think we're pretty good at doing that. But this pandemic just put this extra layer on people that nobody was prepared for. And so whether it is that you couldn't see your parents, right, because they were vulnerable, or you couldn't go to a nursing home to see grandparents, um, I think it just very slowly can wear on you and has worn down. And I think, people just aren't even conscious that they're experiencing burnout because everyone's trying to pretend like, oh, it's the pandemic, but we're still going to go to work. We're still going to go to school. We're still going to exercise. And, I think, for me personally, I don't think it was so much a conscious decision to start taking care of myself. But even with some of the disadvantages that happened, like I did get to work, we were kind of taking turns working remotely and doing telemedicine and things like that. And the kids were all of a sudden taken out of school and activities. And so it's like, oh, like there's no distraction of like the whole human doing. And then it was just like the human being. And we were all there together. And so that was like, well, that part's nice. and what can we do and what can we do to distract. And so, we did a lot of riding in the bikes. I don't didn't know anything about planting, and so was able to plant some hydrangeas and do a little bit of yard work. And so some of it was there to distract, but then it kind of felt nice to just kind of pause. And so now let's see, gosh, I can't believe this. I'm turning 50 next year. But I started thinking, before, as a former athlete, like, you work out to, feel good and, be in shape. And now I'm like, wow, what should I do so that I don't die later? And like, what am I most at risk for? So like breaking a hip, or so for me, that was like, I should work on balance and flexibility. And that's when I started going back into yoga. I had done that as a practice for a while during residency, before kids, and I really liked it. And then life happened and I was busy. And, you learn as a mom to kind of be a cheerleader on the sideline, and forgetting about what you used to do or what you like. So as soon as I started doing that, and it was just really, and you've heard the story, but in very small doses. I listened to a great TED Talk about cultivating a habit with just 1 minute a day of something. And the narrator used the example about a marathon. Well, I don't run, I have no intentions on running, but I said, well, what if I just do 1 minute of yoga a day? And then if I'm too busy, I just do the 1 minute and I don't feel like I broke my streak or I'm a bad person or whatever. And then, as soon as you sit on the mat or you really get in that mindset, usually I do more than 1 minute. I think I'm on day 87 today. Not that I'm keeping track, but I am. And so, there's been a couple of days where it literally has just been a minute of a mountain pose and deep breathing. And you know what? That was what I needed. That's what I could do. But usually it's 20 minutes or 30 minutes or that's kind of what I have done. I've also been just really intentional about knowing that you can't do it all the same every day. And so like some weeks I'm super busy at work and I'm involved in a lot of organizations. And so that's my busy week. And then other weeks, you know what, I'm just not, like, the kids have a bunch of stuff and I'm going to do stuff with them. Or instead of on the weekend feeling like I'm being lazy, just really reframing that to I'm resting, and rest is important because I need to save my energy to do other things. So it's both a combination of like actually doing things, but really I think more of it is just the perspective. And so like shifting things around and just being gentle and honest with yourself about what you can do and what you can't do. And luckily I have wonderful friends like you who were telling me like, oh, I think you're doing too much, so have that person who can really be honest with you and say, how's it going? Like, I haven't heard from you in a while, or is this sustainable?
Yeah, so lots of things, it sounds like. The 1 minute a day is a huge deal, certainly in coaching for sure. We talk about that a lot because, we have studies that show that it works. And clearly you're telling us that it works. And it's the same way for me when I start like my clients off with just breathing exercises. We just start with 2 minutes a day, or meditation with 2 minutes a day. And it's really the rewiring of those neural pathways and making those connections. That's really what is the hardest part. And so most of us, like you said, can decide to do something for 1 minute or 2 minutes a day. And then if we stick with it, then look what you have, right? Like, you've gotten the mind, body, spirit experience of yoga every day. And it's a real gift that you have been able to incorporate. But, if 89 days ago, if someone had said, you're going to need to do yoga 30 minutes a day, you'd been like, no way. And so what a brilliant, sneaky way. So one of the ways that sometimes we think about it is we kind of sneak around the amygdala, so like we don't sound the alarm of like, well, I have to do something so different. Like, no, just give me a minute. That's all you need. And so that was really brilliant. And then, just the idea of having your tribe and having almost like a barometer. I certainly, I think that's a huge boon and bonus for us as women, because sometimes, it's hard for men to have as much of a tribe as sometimes women can have. So I think that's really great. And then just spending that time outdoors and then making intentional rest time. I mean, those are all really valuable lessons to take away, regardless of what happens in the future, and really just stick with that empowerment and make self-care really just a very natural part of your life, because it certainly gives back dividends for you. So that's brilliant. And thank you for sharing that.
Sure.
So let's say I asked you to give like your best advice based on, sort of how, this culture, there's a culture shift. Obviously, you're involved at the top of that, which is, I'm really grateful for that because, well, just my 2 cents worth, just when, I was training, I'm older than you. When I was when I was training, there was just a lot of, certainly in medical school, there was just a lot of invincibility, sort of this the stance of invulnerability, never admitting if you're wrong, never admitting if you're not feeling well, going to work and passing a kidney stone while you're seeing a patient. Not that that happened to me, but it did, and it probably has happened to you as well. So those sorts of experiences that we just took as like natural and whatnot, just like sort of that shift. Do you see a shift happening now? Because for me right now as a physician entrepreneur, I'm really trying to move the puzzle pieces one person at a time. And I actually have a group program coming up. So I think we're really going to try to move, a lot of people into the, kind of wellness and self-care and empowerment, kind of phase. But, you, to a certain degree, better or worse, you kind of sit at the top of that pyramid, right? With a lot of young physicians, with a lot of, just physicians in general, medical staff. So what advice would you say, or what are you looking at as far as the future is concerned, as far as that culture shift?
Yeah, it's interesting. And so it kind of flows in both directions, right? Between the younger physicians and then us maybe middle career people, then people sort of who've been doing this a lot longer. And it is, yes. And, we were kind of trained before work hour rules and things like that happened. And, it's almost like a badge of honor that you wore. Well, I, worked 36 hours. And then, we might have some people that are just, no, like they're just not going to do it. And, really, and maybe in the past that was looked down on, but it's really such a healthier, more sustainable way to take care of patients, but then also take care of yourself. We know that, professionals who are working this many hours at this level at a really high rate of burnout. So we can learn a lot from people that say, guess what? I don't want to work that much. And that's okay. And so, like, one thing I try to say is life work balance instead of work life balance, because life should come first, right? Um, and so I think it's just kind of being open minded. And so just because we've done something a certain way for so long doesn't make it right. And there's so much that you can learn and so many kind of new ways of thinking you can prune if you are just kind of open minded and to say, well, why not? Let's try it that way and, see what happens. And so one of the things you mentioned earlier about, maybe men not, kind of thinking about things in that way or being able to express what they're going through. I mean, they're definitely seeing the strain as well. And so I'm on the Clinician Engagement and Wellbeing Committee here. And so throughout the pandemic, and even before that, we put out information about resources for doctors. So here in Duval County, there's a free program for doctors where you can have some coaching sessions if you're struggling. And so this is so that people, even doctors, sometimes worry about a stigma of reaching out to a psychologist or a therapist for help. So this is, a wonderful anonymous program for people. So we've been very vocal at putting out that information and then putting out our own internal resources here. And so it's funny, like you say that and people's eyes kind of glaze over at lots of meetings. but I can't tell you how often it happens that somebody will text me or call me even. And these are people that you would never think um, one, would struggle or that they would reach out for help when they're struggling. But so just that repetition of letting, normalizing it, this happens, this is here, this is a resource. If you can't remember where to find it, on your computer, call me and I'll help you. So I think that's really been a blessing. So for those that are, that champion at their, workplace or family or whatever, don't give up. Like those seeds do sink in. And I think whether that be with, some of your colleagues or even family members, children, when when they don't look like they're listening, they're listening. So I think that's definitely one thing. You said the other word, and I think vulnerability. And so, as a leader, you do need to be calm, but I think it's okay to be vulnerable and transparent and say, I don't exactly know if this is the right way to do things, or go back and say, looking back, I might have done it differently now. I think that gains a lot of trust with people, and then it gives people the permission to say the same thing if they're struggling. And so it's taken me like almost 50 years to realize a very basic, simple concept that I think a lot of professionals don't, is that one, you're not perfect, shocker, and you don't need to strive to be perfect. It's okay, we're going to mess up, we're human, right? And so it's okay to just be honest and learn from others and say, that didn't go well. Can I, do it differently? I'm in the middle of writing an article. I don't know where it's going to go, but it's called The Art of the Do-Over. And it's such a basic, playground concept that we forget as we get older and busy. So I think, like you said, like being vulnerable and then taking the time, just like we're doing now, to like sit down and reflect. Like somebody I'm not going to be able to give her credit, but I went to a conference once, and the way that she presented things was what, so what, now what? So like what happened? So what did it mean? And now what are we going to do? And I think that should be kind of like a constant way to look at things as you're going through these new experiences.
Yeah, no, it's brilliant. Yeah, just taking the stories away, taking all the
Mm-hmm.
stories that our brain makes up away, and then just looking at what happened and what can I do differently. That is definitely a lifelong skill that I think we're all definitely striving towards. And it is a worthy cause for sure, because when we start to strip away some of that, especially the negative narrative, then we can actually see things for what they are and then actually deal with them and then take action. Like you said, take messy action sometimes,
Yes.
but
Yeah,
take
and the
action
new thing,
nevertheless.
yeah,
Mm-hmm.
the new skills, like because
Mm-hmm.
of this, guess what? Like we weren't doing telemedicine. Now we're doing lots of telemedicine, which is so helpful to our patients that can't get in the office. And because of this, we've learned some different organizational management. And so, I think hopefully that this is just a chapter, not the whole book and all of this. And then I think there's going to be some amazing research and innovation that came out of all of this. And
Yeah, I
so
mean, I feel like it already has with the vaccine. It's such an amazing, accelerated,
yeah,
sort of
and not
movement for
just about
science.
yeah, like we're
Mm-hmm.
so self-centered in our little silo, but and not only did it go to our county and our state and our country, but this is such a global issue. And so I think being able to look at what are our first world problems versus
Right.
which vaccine should I choose versus do we even have a choice of a vaccine at all. So I think that that's been very eye-opening for a lot of people.
Yeah, for sure. The virus does not discriminate. That's for sure. So, yeah, yeah. Well, I have had an amazing, amazing time and I've learned so much. Thank you so much for sharing your wealth of knowledge, your journey, just your experiences. And I am really grateful, just not just for your time with me, but for the work that you're doing and for the difference you're making out there in the world, not just as, a physician, but a physician leader, a physician, real kind of out there on the forefront of this and forging a pathway that a lot of people aren't able to do. And so I'm really grateful for that. And I'm also really grateful that you're my friend.
Thank you. I feel the same way. And I think it's just so brave that you have, like really taken a deep look at what your vision is and what your gift is, and that you are reaching out and, helping people one person at a time. I think that's something we're very similar. Like, I train doctors that are going to go out there and, hopefully affect patients, and you are, really in the front lines with these patients and helping people really be the best version of themselves, which is then going to affect their family and the people that they come in contact with. So it's all a lot of work that we have to do, and we're so privileged to be able to do it. And